Let's invite Professor Zhang Wei to host this session first. Of course, I want to summarize. Alright, then Teacher Hu, I won't introduce you any further. I am honored to co-host the first special session with Teacher Hu. I was especially honored to attend the major event of Cisco leukemia and lymphoma. Cisco. Respected 6 chairpersons of the conference, hello everyone. So I won't introduce Teacher Hu, including myself. Most people are probably already very familiar with online meetings. Our first speaker is Professor Wang Xiaopei from Peking University Cancer Hospital. Xiaopei specifically told me I had to give a brief introduction. Xiaopei is someone I really admire because I also love working out. So she is a fitness enthusiast. He has always been young and has very rich work experience. But she has always been very low-key, so at her request, I won't introduce her position any further. So for the past 20 or 30 years, Xiaopei has been doing autologous transplants. Therefore, she has extensive experience in autologous transplantation. Teacher Xiaopei, please explain the big data of autologous transplantation. There is a request. Thank you, Professor Zhang Wei, for the introduction, and thanks to Professors Hu Liang, Ding, and Zhang Wei for co-hosting this session. Festival. Now, let me introduce the Autologous Transplant Working Group since its establishment last year. Why is my replacement light gone? Let me share my experience changing the lights. You can see it, right? In this segment, I will introduce the big data situation regarding autologous hematopoietic liver transplantation in China. Since our Autologous Transplantation Working Group was established last June, the primary task is to compile the data on autologous hematologic liver transplantation in 2021-2021. A preliminary statistic. Some variables are also collected synchronously. Through several months of effort before February this year, we collected 521 cases of autologous transplantation from 211 centers in 29 provinces across the country. Compared to 2020, there is a significant increase in these cases, with an approximate increase of about 2,000 cases. This work is also the result of efforts by more than 200 hospitals and centers, as well as Professor Ma Jun and Professor Zhu Jun's leadership work. From the regional distribution, the eastern region has the most cases, accounting for around 3,000 cases, while the western and central regions have fewer cases. This may be related to the distribution of large medical centers in our hospital. Looking at the various regions, Beijing has more of them. This accounts for a relatively large proportion. Then came the major provinces of Shandong and Hunan. In areas with larger populations, these provinces with large medical centers, the number of cases they have performed is also relatively high. Looking at the capacity of autologous transplants at each center, 5 hospitals handled over 100 cases annually, 1005. 24 companies had cases ranging from 51 to 100, and 51 had cases ranging from 50 to 21, 5110024502151. There were 61 cases ranging from 10 to 20, and some centers had fewer than 10 cases. 10206110. Most centers usually perform around 50 cases 50. Some other. Why do some of our centers do less? It is also possible that this case went to another center. Also, some lymphoma patients are treated in hematology departments. So, although many of our centers are large, their main focus is on acute leukemia and stem cell transplantation. Due to limited resources, graft restrictions may be somewhat limited in autologous transplantation. This means that we still have potential to improve these capable centers in the future. When it comes to choosing transplant indications, it's not about the indication, but about choosing different types of diseases in the transplant case. Seeing that lymphoma still accounts for the majority, lymphoma and myeloma account for the vast majority. As for other types of tumors, if you look at nursery mother syndrome and this electronic oxygen denaturation, which is basically a disease of intestinal cells, there are also leukemia, neuroblastoma, and other cases, including germ cell tumors. We accounted for 86.7% of those performing transplants on the front lines, 86.7%. And then salvage transplantation, meaning they are performed only after relapse. There is a 13% ratio. 13%. The median age is 51, which is quite consistent with the age we are suitable for transplantation. 51. The male-to-female ratio is roughly slightly higher for males than females. Gender and age distribution, we still have about 3,000 cases of males 3000. 2,200 cases among women, which is about the same as the previous one. 2,200. In the largest age range, between 18 and 60 years old, 1860. This accounts for 81.4% of our more than 5,000 cases. 500,000 and 81.4%. I think this is because, during the treatment process, in terms of incidence, age, and number of cases, this age group is also the stage with the highest incidence rate. Also, at this stage, most people have medical insurance. They also have jobs, relatively strong financial means, and can afford autologous hematopoietic stem cell transplantation. This type of treatment is why the number of cases in this group is quite high. They make up the vast majority. The before transplantation had reached 3,366 cases, accounting for 64%. This is in line with our concept, which indicates that autologous hematopoietic stem cell transplantation in the CR state yields the best results. It is the best. About 30% of the cases were also done in a PR state. For these cases, performing a large-dose chemotherapy combined with autologous hematopoietic stem cell transplantation for consolidation in a very good partial might significantly increase the efficacy of conventional treatment. There are also some attempts to do this in the PD and SD states. We will further analyze these data in the future for these cases. We will also monitor their outcomes and see if autologous transplantation is performed in this state. Its benefits are statistically meaningless. Still, when absolutely necessary, autologous hematopoietic stem cell transplantation is performed in this state. There are still some benefits. From the perspective of pre-transplant status, some of our centers have also conducted research. The first time you do it in CR mode, it's best CR. However, during first-line treatment, if a very good PR can be achieved, PR. At this time, autologous hematopoietic stem cell transplantation is performed for certain types of lymphoma. It is better than recurrence and then treatment to reach CR again, meaning it is done when CR1 is equal CR1. It should be more effective than CR2. CR2. However, these studies did not involve particularly large-scale studies. In the future, we can still use big data to further analyze this situation. In terms of the number of hematopoietic stem cells, look at ours. Achieving our standard ratio of 2.0 times 10 CD34 positive cells per kilogram of body weight, 2.0 times 10 CD34. Another 10% of patients do not reach this level. 10%. However, he also successfully underwent autologous hematopoietic stem cell transplantation. Among these patients, we actually draw on our experience as autologous transplant specialists. Back then, when CD34 positive cells cannot be measured, we mainly refer to the number of mononuclear cells. CD34. So when these are below 2 times 10 per kilogram of body weight, 2 times 10, we sometimes refer to its mononuclear cell count. If the number of mononuclear cells also reaches a relatively high level, in this case, we may also be able to successfully complete autologous hematopoietic stem cell transplantation. These efforts to mobilize stem cell collection have not been very successful. These patients who are not in the ideal state of our life. It would also be possible to give him an autologous transplant opportunity. Speaking of the second transplant again. Based on literature or evidence-based medicine. Some types of lymphoma, especially myeloma. It is a second transplant that can significantly benefit patients. This is mainly reflected in multiple myeloma. The treatment is relatively simple. so the opportunity for a second transplant is greater. Some types of lymphoma, including Hodgkin's lymphoma, have shown, in German research or other center studies, that a second transplant is clearly superior to a single transplant. So in our cases of secondary transplants for lymphoma and multiple myeloma, they still account for the majority of our second transplant cases. Other diseases that can undergo a second transplant include leukemia, neuroblastoma, and other types of diseases. So in the secondary port, from this data, we can see among more than 5,000 autologous transplant cases, only 100 cases had a second transplant. So in a second transplant, if it is indeed evaluated during clinical proceedings, it is beneficial for the patient, under his condition, including the conditions of stem cells, the body, and the funding if possible. We still have room to improve in future secondary transplant procedures. Speaking of non-recurrent mortality, it means let's see just how safe autologous transplantation really is. Based on the statistics from our more than 5,000 patients, only 46 cases occurred within 100 days. 46,100. This proportion is very low. According to some international reports, the non-recurrent mortality rate related to transplantation is also high. It can reach as high as 3% to 5%, 3% 5%. But our national level has already reached a very safe level. The non-relapsing mortality rate is less than 1%. 1%. From this perspective, we are using autologous hematopoietic stem cells from high-dose chemotherapy combined with autologous hematopoietic stem cell transplantation. The rescue method is very safe and effective. So in the future, in many relatively small and not very large hospitals, or they have concerns about autologous transplantation, believing the side effects are significant, the risk is very high. In these hospitals, we can conduct this work through the cooperation and communication of working groups, even in more grassroots hospitals. Now, I will separately introduce the situation of autologous transplantation for lymphoma and multiple myeloma. Some data mainly come from our statistics on this autologous transplantation. Another point is that the national disease burden of lymphoma and multiple myeloma. Data from 2019 in China, which comes from CDC data. In 2019 in China, the number of newly diagnosed cases of non-Hodgkin lymphoma was over 9,400 cases. And for non-Hodgkin lymphoma it was around 92,000 cases. That adds up to 100,000 cases. 10. This morning, Professor Liu Yiping also presented the big data conclusions related to lymphoma. His data shows that the annual incidence of lymphoma was about 70,000 in previous years, 7. Now it has risen to 100,000, so the incidence of lymphoma is on the rise. 10. The peak incidence of lymphoma occurs between the ages of 65 and 69, 65-69. Its peak incidence occurs between the ages of 90 and 94. 9,094. Why did it become a peak at that time? Very few people live to the age range of 90 to 94, 90-94. So when the base number is low, the incidence rate rises. This is one aspect of national statistics. Non-Hodgkin lymphoma occurs between ages 65 and 69, 65-69, which is consistent with the peak number of Hodgkin lymphoma cases. The number reached 12,760. 12,760. Its incidence peaks at older ages. The cause is the same as Hodgkin's lymphoma. Next is multiple myeloma, with 19 years of data on new incidence rates of multiple myeloma, 18,790 cases. 18,790. Its peak overlaps with lymphoma. The peak number of cases occurs between the ages of 65 and 69, 65-69. The peak incidence is also in a high age phase, reaching the age range of 75 to 79 years old. In so many cases of 100,000 occurrences, how many people have actually undergone autologous hepatocyte transplantation? This is about the utilization rate. The utilization rate refers to the proportion of people who underwent autologous and molded hepatocyte transplantation among the total number of cases. The lymphoma utilization rate is only 2.4%, which was also mentioned in Professor Liu Yiping's report this morning. Multiple myeloma, on the other hand, is higher at 11.3%. In autologous transplantation, the recipient age reached 52 years. 5.2. Sometimes our data also includes children's. From age 4 to 73, the male to female ratio is 1.3 to 1, for 731.31. Basically, there are slightly more men than men, and there may be factors that affect the outcome of the transplant. We accounted for 400 first-line transplants. 400. Salvage treatment means that after the first-line chemotherapy, as a first-line transplant, 400 cases were conducted. 400. Salvage treatment refers to transplantation after recurrence or second-line treatment, accounting for 14.4%. 14.4%. The porting ratio is already shown in this image. The usage rate is still relatively high in the eastern region. In this age group and gender distribution, men of all ethnic groups are older than women. Then it peaks between the ages of 55 and 59. 5,559. This is similar to our autologous transplant. I just mentioned some reasons, including the number of cases affecting patients, including their financial situation. Even his physical condition is influenced by factors and is related. So in future analyses, we will examine these results in detail. In the distribution of this disease, between the ages of 20 and 65, 2065. All age groups have reported over 100 cases. 100. Multiple myeloma occurs in more than 100 cases across all age groups between ages 40 and 70. 4070100. The peak is reached by those aged 50 to 54, accounting for 14.36%. 505,414.36%. Multiple myeloma accounts for 57%. 57%. This is the usage rate of statistics. The usage rate is very low among people under 10 and over 65. 1,065. In other words, among these patients, there are those unsuitable for transplantation. Still relatively less. Our main focus is on the age group from 20 to 50 2050. Its usage rate is also generally low. 6.5% are aged 40 to 44. 40,446.5%. In other words, out of every 100 patients, 6.5 may undergo autologous transplantation. 1006.5. Cirrhosis transplantation. The peak of multiple myeloma also occurs between the ages of 45 and 50. 4,550. This age group is one of the most likely to receive transplants. This proportion has reached 2.4% nationwide, 2.4%. This ratio seems quite low, at least 1,000 cases, 1,000. Only 24 patients underwent autologous hematopoietic stem cell transplantation. 24. Judging from the distribution of transplants, it is still Beijing. Places like Tianjin and Chongqing have relatively high transplant rates. Among patients treated at these places, the number of patients who reach the autologous transplant stage is relatively high. Some provinces, like Heilongjiang and Inner Mongolia, have large hospitals that can also perform transplants. However, some patients, once they discuss transplant treatments which are costly and relatively riskier in their local areas, may choose to go to Beijing, Tianjin, Shanghai, or Guangzhou. These places are considered more reliable by them. Through our big data statistics and the work of our autologous transplantation working group, we can bring these patients back to their local areas. This not only enables hospitals in those regions to widely carry out autologous transplants, but also reduces the inconvenience of patients traveling around the country for treatment. Among our 211 centers, we counted 2,443 first-time 2008 patient transplants, which had received one transplant. 211082443. This is not the first transplant, this is a pre-treatment plan. The pre-processing scheme means that the B-mother scheme and the BICU scheme still hold an absolute advantage. BB. Our centers are still comparing traditional pre-treatment solutions with more options. There are other options as well, because among the cases reported by various centers, there have been many attempts for various purposes. This includes improving anti-tumor efficacy, enhancing implantation, reducing complications, and adjusting pre-treatment protocols for specific tumor types. This is for various purposes, with various other pre-treatment schemes being tried. However, the number of these cases is still relatively low. In the future, as the number of transplants increases, it's the advantages of programs outside of Mother B and Subject B, BB. What other advantages are there? Let's analyze them. Among them, I picked a few, one based on the Cetavine. Cetavine. Nowadays, most people use it for the central nervous system, the primary or secondary central nervous system. In the lymphoma pre-treatment plan, there is also the TBI regimen, which is mainly used in lymphoblastic lymphoma TBI, and NKT cell lymphoma. NKT. This means more and more centers are experimenting. If its advantages are indeed demonstrated, then in the future, through big data statistics. After publishing these results, we wonder if we have the potential for promotion. Now it's just statistics, but the final effect is whether it has an advantage. We also have further increases in case numbers to confirm this. The usage rate for multiple myeloma is clearly significantly higher than for lymphoma. It reaches 11.3%, which is relatively simple with the pre-treatment plan. 11.3%. It's the single elimination trouble blue. Furthermore, regarding the efficacy of 2 transplants for multiple myeloma, it may still have an advantage in terms of efficacy. But now there are many new drugs, such as targeted drugs and chemotherapy drugs. These medicines are constantly emerging. Are there some whose efficacy rivals autologous hematopoietic stem cell transplantation? Because our center does not provide multiple myeloma treatment. Further analysis is conducted with the relevant experts. Multiple myeloma is treated in major medical centers in major cities like Beijing, Tianjin, and Shanghai. Its usage rate is much higher compared to lymphoma. So in this aspect, when we analyze the data later, refer to some experiences from more experienced centers to offer some guidance to our other centers. Pre-treatment plan for the first transplantation of multiple myeloma. The vast majority are based on mefalin as a single medication. But there were other attempts, including a partnership with pentanzomi, combined with bendamustine, and attempts to combine with some other drugs. Looking back now, most people may actually recognize the single-agent methylene pre-treatment solution. Because it is relatively simple to use, has fewer side effects, and offers more opportunities for a second transplant. Some other attempts are also purposeful, possibly aimed at further advancement. Step to enhance efficacy and prolong disease-free survival. The number of cases is relatively small and further analysis is needed in the future to see if we can draw a conclusion. I have finished introducing the specific content. Next are the more than 200 centers.